Hi, good evening, participants. This is Anita here, welcoming you all for this wonderful evening of this session, where it's going to be an enlightening session for you for the PG career that you are aspiring, the PG seats that you're looking forward for in India, and possible options of foreign countries also. So I'm going to take you through that. And if you have any questions, you can raise your hand or you can put it in the chat so that I'll be able to, answer those questions and then we can continue. Who have completed previous years, and possible that some of you might have attempted your NEET or DND or AIMS examinations, also looking forward for a PD seat, and might not have got the seat that you're looking forward for. Okay. But here is a golden opportunity for you to pursue the PG of your interested branch, and preferably in your preferred location, and all the possible opportunities of job and designation in India and abroad. Okay, so when I meant the title and practice, to work and pay scale will be high. Now I'll tell you how. Okay, so I've just mentioned one heads up here, just for your understanding, that an MBBS, the number of MBBS seats versus PG seats in India. So as of current statistics, we have around 76,193 MBBS seats in both government and private, and we only have around 30,000 PG seats, though the government says they have increased, but actually they haven't, as you all know. So in addition to the 76,000 MBBS seats, we also have a couple of thousand students coming from foreign countries and clearing FMG examinations. So the PG seats is not even 50% of what UG seats are. So definitely there's going to be a lot of doctors left over and writing the NEET examinations again and again. So what should you do if you're not getting a PG seat? So I think these are the three questions which is running in your mind now. It is, will I get my desired specialization if I try again next year? That is, I think many of you are preparing thoroughly for the coming NEET examination, which is in December, January. So, but are you sure that you'll get a PG seat of your branch? That's your first question. Or if not, will I be able to afford a management seat, which ranges between 1 crore to even 3-4 crores, as you know? Because a lot of my doctor friends have already told me that they are receiving a lot of messages that just for namesake you can write NEET examination, and but they can guarantee a management seat. So that is what is currently happening. So everything is corrupted. Or the best option is, should I get into an administrative role of MBA something? I think these three questions are all going on in your minds. So think about your family life, financial capabilities, and personal liabilities. I would say, the option that I'm going to provide you will help you to overcome all these questions. Okay, so here it goes. That is the reality is, it's definitely difficult for you to get a PG seat. Though you prepare well, because of caste, category, competition, definitely you're not going to get what you want. So, but it doesn't mean that PG result is a measure of your intellect. Absolutely not, because I've seen a lot of doctors who have scored more than 65% of MBBS percentage consolidated. They even failed to qualify in PG. So it doesn't mean that they are bad, right? Okay, so in this situation, will you be interested in a globally recognized PG program that does not depend on your PG NEET results? So that is what we are offering. We are not worried about your NEET results. We just want your MBBS registration. If you are a registered MBBS doctor, then you are eligible for this program, what I'm going to tell you now. Okay, I think some of you might have heard about this Royal College UK exams training. Have you heard about this, participants? Like MRCP, MRCS, FRCS of UK, you might have seen it in Senior Most Consultants Name Board. Have you seen this or heard about this? Dr. Yakub, have you heard about this? Okay, all right. I'll just give you a quick heads up of what this is. That is, it has a history of more than 1,500 years, and the royal family has formulated it, and it was all barbers, and everybody started doing surgeries during those years, and there was a lot of mortality. To overcome that, they brought in a rule that only qualified physicians and surgeons should, work on the patients. So that's when College of Physicians and Surgeons was formed, and now that's a copy of what is happening in Mumbai, CPS, College of Physicians and Surgeons. Later, they added a prefix which is R that stands for Royal, so it became Royal College of Physicians and Surgeons. And now they have various colleges. They have a separate college for physicians, for surgeons, for gynecologists, for radiologists, everything. But it's not a typical college where you go sit there, study for 2 years or 5 years. It's just an examination conducting body. And if you want to specialize in internal medicine, then you will become a member of that Royal College of Physicians. So MRCP, which stands for Member of Royal College of Physicians. So you will become a member. And what is the advantage of becoming a member is, number one is your designation. So wherever you go, be it in India or in any foreign countries, your designation will be definitely higher than a normal MDMS or DMB person, and your pay scale is double, which we can 100% guarantee you even in papers. Even in India, or India could be like 3/4 of a normal MD, but in foreign countries like UK, Canada, Australia, Singapore, Malaysia, except for United States, if you're getting into any foreign countries, your package will be double. That is for sure. So, and you have much more benefits of becoming a member. Now you might ask, like, why should I do this? I don't want to get into UK. I just want an MD/MS degree or a diploma degree. See, this Royal College qualification is equivalent to an MD, an MS, or a DM, or an MCH. So, and you're going to do it within this 3 years. You're not going to go anywhere out of India. You're not going to spend time, extra time. You will be doing it like any other PG doctor. So, what are the different awards? So, these are some of the colleges and the memberships. In the first one is for physicians, internal medicine, and then you have member of Royal College of Surgeons, for gynecologists, for pediatricians, and you also have for pathologists, member of Royal College of Pathologists, and radiologists. It's a direct FRCR. See, actually, it starts with a member level, like how we have Rotary clubs in India. So, you first become a member after your MBBS and PG, and then after member you get on to a next highest level, which is fellow. For that you have to wait for 6-7 years, but luckily radiology is the only stream where there is no member level. It is a direct fellow level. So in all the other levels, like after MRCP with 7 years of experience, you become an FRCP or an FRCS. Okay, and then there you go, like psych, MRC psych. So these are some of the memberships and fellowships that these colleges award. Okay, now actually we are offering 5 branches, which is internal medicine, pediatrics, OBG, radiology, and surgery. Okay, so see, here it's a golden opportunity where you have the liberty to choose what branch you want, and you will have the liberty to choose wherever you want to study. So I'm just going to come to that pointer in my later slides, but now for your understanding, I'll just quickly tell you what is MRCP and how easy it is to crack. Okay, see, the first point before even I can get into is, NEET is a competitive examination where everybody is preparing through Bhatia or DAMS or OSLERS or speed coaching. So though you prepare well in this competition, you might not get it. But this MRCP, MRCS, any Royal College qualification, there is no competition at all. No competition. So, on a yearly basis, these exams are conducted in India and abroad. So, if, like, say, Dr. Vignesh wants to apply for MRCP Part 1, you have centers in India, that is in Delhi or Bangalore or Hyderabad, Mumbai. You can choose center you want, like how you choose NEET exam center. You choose the exam center, you sit for the exam, and if you're getting the minimum required marks, then you're through. You're through in the Part 1, you're going into the Part 2. So unlike NEET examination, there is no restriction, no limitation that only these many MRCPs will be awarded or nothing like that. So as long as you're getting the minimum required mark, you're through. So this is more real and practical rather than you banging your heads for another NEET examination. So am I clear, participants? I hope you all can hear me. Am I clear? Yeah, all right. Thank you. Thank you, Dr. Yakub. In case if you have any questions, you can type in and I'll be able to answer that for you. Okay, so that's the most important thing that I would like you guys to keep in your mind, that don't think this MRCP is needed only if you have to get into UK. Why should I need it? It's only for UK. Or, don't think that this is required maybe after an MD or a DM. No, it's not like that. And don't think that this is a tough examination. It is absolutely an easy, non-competitive, easily scorable examination. Okay, now I'll tell you how it works. See, for the part 1 examination, you just need to have 12 months of hands-on training in the branch, like say internal medicine. Okay, and it's just 100 mark questions. I'm sorry, 100 MCQs. So you have 200 MCQs, and you have 6 attempts. So for clearing part 1, 6 attempts, part 2 and part 3, every part you will have 6 attempts. And the good thing is these exams are conducted thrice a year, like say Jan, May and September. So you don't need to wait like NEET, which is happening once a year. Now they have cancelled July wala DNB also. So you don't need to wait till another year. So in case if you fail in Jan attempt, you can give it in May immediately, or if not in September. But according to our training module, our students are able to crack 85% in the first attempt and 100% in the second attempt itself, even if you are an average MBBS student. So 2 attempts is all maximum you would need in order to crack one part. Okay, so let's assume you're clearing it in 1 year and 5 months. So the same goes for the part 2 examination and then the part 3 examination. So overall, it will take approximately 3 and a half years max. That's all, not more than that. 3 years to 3.5 years, within which you'll be able to complete all the 3 examinations. And if so, then you are becoming a permanent member of Royal College of Physicians. Now, if you have become a member, what is your primary benefit in India? First thing is, you can definitely take it to your state medical council and get it registered. Okay, get it registered as an additional qualification. Okay, so you'll put as MBBS, MRCP of UK. MRCP is a PG qualification, so you can work in any private corporate sector as a PG doctor, or you can work in any government hospitals as a PG doctor. You can work as an assistant professor in any medical colleges. Because as I said, it is equivalent to MD, MS, DM and MCH. So it is there under the Teachers Eligibility Regulation Act of 1998. So in the MCI itself, so you guys are legally authorized to practice as an assistant professor also. Okay, so everything you have. Right, so why do you need to bank for an MDMS or a DM seat in India? You have this. All right, so now not only this, you have great opportunity for, as I said, all those countries. So I'm just going to get into that. But let me just complete quickly the next slides, which is for MRCOG. And here you have the link. So I'll just share the presentation also for your reference. If you click on the link, it will just take you through the page. Okay, so likewise, we have MRCOG for gynecologists. So since we don't have much of female participants, are you interested in gynecology? Anyone? So that I can take you through, or otherwise it's the same concept of 2 theory examination and 1 clinical examination. So the same rule goes, like you have 100 single best answer questions. So you have to write it and crack it, and this is happening twice a year, and then part 2 is happening thrice a year. So all these exams, the theory parts will be either multiple choice questions or single best answers or extended matchings. Nothing more than that, and you'll be given enough practice questions. Okay. Okay, so let me just complete some question answers here. Okay, Dr. Yaqub had a question. Doing internship for 1 year qualify you for MRCP examination? No, doctor. That is, internship is a part of your MBBS to get your permanent registration. So post your permanent registration, you should have 1 year of PG training. Training in internal medicine department, only in internal medicine department. That is what we are trying to offer you. Okay. See, in all the branches, I got the next question also. In all the branches, you have to have that minimum 1 year of hands-on training in order to be eligible for the Part 1 examination. So, since we have questions for CPCH pediatricians. See, actually, pediatricians is a little lengthy. That is, you have three theory. Theory that is foundation of practice, theory and science, and you have applied knowledge in practice. So these three you can take it in any order, and once it is completed then you go for the clinical examination. Okay, but these are very small ones, so it is really easy. See, look at the part 1. So you'll only have like basics of child health, so that's the topic. And then for part 2 it will be like scientific, physiological and pharmacological principles. And then the third one is knowledge evaluation and clinical decision making. So that's the one. So CPCH is also easy, but you definitely need to have 1 year of clinical hands-on training in pediatrics before getting in. And I'll tell you what the stations. See, here also you have 10 stations, and in 10 stations you see two history taking and clinical video scenario. And then in OG also you'll have 5 stations. In CP, MRCP also you have 5 stations. Stations is nothing but you have like 5 rooms, so 5 question papers. So let's say there's the first room for internal medicine, and your examiner will be waiting outside. So the question paper, let's say you have 10 minutes time and you have a patient sitting inside, and if you have to analyze the respiratory system of the patient, then what you have to do? Basically, you know the procedure, you know what to do, but the only thing is how you are doing it. Because being Indian doctors, we will not have enough time to greet them, to smile at them, to even seek permission with them, right? But the international standard is a little different. So it's more of how we are handling the patient. So you have to greet, you have to empathize, sympathize, smile, seek permission. Patient reserves a right to know what's happening, what we are doing with them. So tell them what you're trying to do and then do. Like I'm analyzing your pulse, I'm analyzing. That's what it is, nothing else. So in MBBS, we term it as the basic ethics, right? So the same one. So one could be a history taking scenario. So you're done with the first one, and then let's say a second one could be a scenario wherein let's assume a patient's relatives are there, and if you have to communicate some bad news to them, and if they are shouting at you, then how will you empathize or sympathize with them? So this is room number 2. So room number 3 can be a couple of reports. You need to go through the reports and come to a conclusion if there's any disease or not. So these are the 5 stations, and we thoroughly train you for this. So by end of the third year, when you appear for this examination, it becomes really easy for you to crack it. So this is the clinical one. Okay. Do I have some questions? No. All right. Okay. So you might be thinking like, how are we going to get trained for this? So I'm just going to come up there. So this is pediatrics, and we also have surgery. See, surgery luckily is the only only one which has 2 parts, that is part 1 and part 2. Apart from that, internal medicine, OG and radiology has 3 exams where it is 2 theory and 1 clinical, but surgery is the only one which has 1 theory and 1 clinical, so easy one. If you want, you can take it and crack it within 1.5 years itself. Okay, this is surgery, and again you have the same MCQ pattern and you have clinical stations. Okay, now coming to radiology, as I've already mentioned, radiology is the luckiest branch where it is a direct FRCR, but it has its own limitations. That is, unfortunately for FRCR, we don't have exam centers in India. So, which means you have to either travel to Hong Kong or UK or right now there's going to be a center coming up in Middle East, but otherwise it will be in, as I mentioned, Hong Kong and UK, Dublin, Edinburgh, London, Manchester, and Hong Kong. So for writing all the 3 examinations, you have to go there and write for the exam. Apart from that, you'll directly get an FRCR. So let's say the first part is anatomy and physics. So 100 questions in anatomy and physics. And then your part 2 is going to be like 3 consecutive days. It will be in 6 modules. It's a little advancement of, like say you'll have interventional radiology or clinical radiology, oncology, all those things, but you'll have 6 modules, maybe like 50 questions each. Okay, and then the third part is really interesting. So you will be placed before an, let's say, an Apple monitor, and you'll have 30 minutes time and 35 minutes, 30 minutes time and 35 images randomly moving, and you need to find out if the image has any defect or if it's a normal image. Okay, so those are all the sessions. So it is FRCR. So you can choose between MRCP, MRCPPH, MRCOG, or FRCR. All right, and this is the basic heads up of whatever I've been telling. Like first thing is your prestige is definitely high, because normal then rather than a normal doctor like your friends, your batchmates will just have an MBBS MD or an MBBS DNB. You will have an MBBS, a master's, and an MRCP. In bracket, you will be writing it as UK. So you can use this in your name board and your prescription. And you're also spending the same 3 years time like the other guys, where they spend 3 years time, but you have something additional which they don't have. So definitely you will have high regard in your family and your peers. And then the second thing is, as I mentioned initially, the package. The package is definitely higher in India and foreign countries when compared to normal MDMS. And you have nowadays, in the competitive world, it was like only MBBS people handling everything 10, 15 years before. But now it's not enough. You just have a pediatrics. You have to have pediatric cardiology or fellowship in pediatric orthopedics, something like that, right? So, only if you have, the hospitals are looking forward for such qualified consultants and specialists, and obviously you'll be paid high. So if you have to stand alone, you need in the crowd, you have to have something additional that we are offering right now. And medical tourism, as you all know, is a booming industry, and they're all looking forward for UK qualified doctors, Royal College certified faculty doctors, qualified doctors, that is members or fellows. Okay, and as I mentioned, it's more than in more than 120 plus countries it is accepted, and you can work as a specialist or consultant in especially these countries like Middle East, East Asia, Africa, Europe, Australia, New Zealand, Canada, without any other additional qualification. Okay, so now I'm going to come to the actual part where you're thinking like, how are you going to get through the training? Yes. That's what I'm going to tell you. And before that, there's a question: are we eligible to do DM or MCH after MRCP? Yes, absolutely. That's the best part. See, like unlike in India, where after an MD in medicine, you sit for a NEET SS, super specialty examination, and again you have a lot of competition. The seats are less. But if you have a master's in MRCP, then even with that, you can sit for a NEET SS examination. But I would say the easiest part is, rather than doing a super specialization in India again, because anyhow you've done your UG and PG in India, you're getting a golden opportunity to do super specialization in countries like UK, Australia, Canada, and all. So it's a direct entry. You can choose the college. You want to do it in University of Dundee because it's a world-renowned university for MCH programs. So you can do it from there. You can do it from University of Birmingham. There's a lot of universities available. There's no entrance examination, and it's a direct entry for you because you are a member or a fellow of that Royal College of UK. So that is enabling you to get into a super specialization immediately. All right. Hope I've answered your question, Doctor. Okay, so I have another question. So how different is it after completing MDMS? Okay, see, Doctor, now for MDMS, are you sure you'll get a seat in India for MDMS? You're writing your coming NEET examination. Which branch are you looking for Dr. Yakub? See, I'll tell you one thing. Now here, the problem here is waste of time. If you are writing NEET examination, it is absolutely waste of time, because if you don't get the internal medicine seat that you're looking forward for, then the only opportunity left out with you is to wait for one more NEET examination. Or otherwise, you have to start preparing for something like a USMLE examination or a PLAB examination for UK, or an Australian Medical Council examination, which is equally tough like a NEET. So you've already spent 2, 3 years, or 4 years, or 5 years after your UG hunting for a PG seat in India. Now you cannot go and hunt for another USMLE or something like that. Now, but if you wait in India again, you're losing out on one more year, and in that year, the competition increases from 2 lakh to 2 lakh 40,000. Because I think you know the numbers. Like 2 years before, it was 64,000 seats in NEET. people who wrote, and then it became 1,25,000. This year it's 1,55,000. So in coming December or Jan, it's going to be 2 lakh students writing the NEET examination. So absolutely there is no guarantee whether you'll get your PG seat. That is the one that you're looking forward for. Okay, so that's why we are giving you the option. Number one here is, I'll tell you the reason of why you have to choose our university, which is Texila American University, which is listed in World Health Organization, UNESCO, and FAMA. The number one is, we don't need your PG qualification. It is not mandatory. If you're qualified, good. If you haven't qualified, it's okay. You can still go ahead. All right. It's enough that you just appear for your NEET examination, because according to us, your PG NEET score doesn't determine your capacity. Okay, so that's just a competitive examination. So if you have your MBBS registration and if you have attempted any of the entrance examination, irrespective of whether it is PG NEET or AIMS or like say JIPMA, you can join our program. So that's the primary one why you have to choose Texila. Number two is, there is no donation or capitation. We don't ask you in crores. We will make you earn in crores. All right, it's actually that is a fact, because the amount what you get as a consultant in UAE with master and MRCP is 4.5 lakhs per month, which you can't imagine in India. If you just have an MD, be it in any metro cities, whether you start working in Delhi or Mumbai or Kolkata or Chennai, your package will be somewhere between 80,000 to 1 lakh or 1,15,000, not more than that. Right, so when will you reach 4.5? But in Middle East, if you're ready to go after 3 years, that is with this masters and MRCP, your package is 4.5. And in United Kingdom, it's going to be more than 3.5 plus, because after United States, Middle East is the highest paying country now. Okay, so we're literally making you earn in crores. The golden opportunity that your colleagues might not get. All right, and we also provide scholarships for eligible candidates. That is, eligibility depends on certain things like the branch that you're looking forward for, your overall MBBS percentage, how many attempts have you taken in your MBBS. There's so many other factors which will determine the scholarship. Okay, now if you want more information post this webinar, you can make a note of my number. I'm going to put in the chat also. My name is Anita. You can, send a message of which specialization that you're looking forward for and your WhatsApp number, and probably where you are currently in India, so that I can get back to you and I'll tell you like what could be the fee structure and where all the seats are available. Okay, so please make a note of my contact number and type in your details, that is your WhatsApp number and the branch that you're looking forward for and your current location in India. So my number is 8056 770 This is my WhatsApp number. Dr. Vignesh, is there any scope of doing master in internal medicine without lab in UK? Doctor, we are giving you an opportunity to get into UK without lab through our option, and that's what I'm telling you now. Okay, so let me complete. Maybe in another couple of slides, you will know how you can get into United Kingdom without lab. So as I mentioned, no donation, capitation. And then the other reason is, number 3 is, choose your branch, as I told you in the beginning. Whatever branch that you want to see, but these are the 5 branches that we are offering currently: internal medicine, pediatrics, OBG, radiology, and surgery. See, the other branches, you might ask, like, why are we not having dermat? See, because dermat is a part of internal medicine, so you can still do it. That is, after you complete MRCP of UK, you can do something called SEC, Specialty Examination Certificate, in dermatology. So in your name board, you can put as MRCP Dermat. So that option is available for you. And the same applies for orthopedics. After surgery MRCS, you can put as MRCS Ortho. Okay, so currently these 5 are the branches that we offer, and some of the locations are, like, say, we have it in Mumbai, Pune, Bangalore, Delhi, Chennai, Hyderabad, and Trivandrum. So in total, we have around 25 plus hospitals. Okay, so you can choose the location and the hospital. Now in this slide, I have to tell you guys 1 plus 1. So what is the dual qualification that you will be getting? See, this university, as I mentioned, was initiated in the year 2010. And we have 3 campuses, which is in South America, Middle East, and Africa. where we only conduct MBBS pharmacy and nursing programs. The PG is conducted in India in association with DNB teaching hospitals. Okay, so if somebody is in Mumbai, we have options like we have Saifi Hospital, we have Just Lock Hospital, we also have Fortis. Similarly, for somebody in Pune, we have KEM, King Edward Memorial Hospital, or in Chennai, we have Kamakshi Hospital, or like Vijaya Hospital, or in Delhi, we have Mata Chanandevi Hospital and Maharaja Aggression. So more than 25 plus affiliated DNB teaching hospitals. So you can choose if Dr. Vignesh wants to be in Chennai doing internal medicine. Yes, you have option. If you want to do it in Bangalore, yes, you have options. You are the one who will be choosing, not us. You can choose as long as the seat is available. So this is basically first come first serve basis, and this is a 3-year program, a full-time program. So if you're choosing, I'll say, let me take an example, St. Philomena Hospital in Bangalore, then you will be a full-time student in the internal medicine department for the next 3 years, along with the other DNB students. So you'll be guided by the HOD or the consultant there for the next 3 years, and you'll have the usual submissions like academics, case reports, logbooks, assignments. You have to do thesis as well. All those things will be happening simultaneously by end of 3 years. And by the end of 3 years, you'll write a final theory and clinical examination. And if you're cracking it, then you will be awarded this master degree. Can you see? Master of Medicine / Master of Surgery. So for surgery, you'll be getting it as Master of Surgery, and for all the other branches, you'll have Master of Medicine in Internal Medicine, in PEDA, or OBG, or Radiology, whatever is the branch that you choose. So this master degree is equal to the normal MDM is what's being offered in India, but the major difference is the qualification is being awarded from an international university, that is Texila American University, in partnership with University of Central Nicaragua. So both these are WHO listed, UNESCO listed universities offering you this qualification. With this, you can work in all private corporate sectors or in your own hospitals or clinics. So this is degree number 1. Now, there is along with Royal College UK degree, which is your MRCP or the MRCS. So somebody who has taken a general surgery program, you'll have a degree, that is a PG degree, which is Master of Surgery, plus you will also have an MRCS of UK. So if, let me take myself as an example. If I have done general surgery, then my name board after this 3-year program will appear as Dr. Anita, MBBS, MS, MRCS, bracket UK. That's going to be my name board, right? I guess you guys can imagine how your name board will appear. So that's the whole point. Yes, Dr. Yakub, yes, you have to be there as a full-time because this is a 3 years full-time PG program. So you're getting a master degree and you're getting an MRCP also, an MRCS also. Okay, so that is a dual qualification. So as I mentioned, the 3 years training program for Royal College UK exam. All of faculties are Royal College certified faculties. They could be from India or abroad. And obviously, you're going to become a member or a fellow of the prestigious Royal College. And I'll tell you how we are providing you the training so that you will become a member. So now I have covered the degree number 1, which is a master degree. So you'll be there in a hospital for 3 years. You'll be given complete hands-on. This is not like an observership. You'll have academics, you have submissions, you have the final theory and clinical exam. And once you're done, you're getting the master degree. Now coming to the MRCP, which is our primary base. And as you have seen in the previous slides, you had 3 examinations, part 1, 2, and 3. So for the part 1, as I mentioned, you have to have 12 months of clinical hands-on to become eligible for part 1. So our session is going to begin by October, another 2 months time. Okay, so let's say in St. Philomena Hospital, you become a full-time student, and we give you an associate membership in the Royal College of Physicians. The moment you join a program, we will give you an associate membership. So that will give you access to all the practice questions, the key updates, learning materials for the MRCP Part 1. Through that, you will write 50 practice questions once in every 15 days. See, it works like that. For an internal medicine guy, if you're posted in the let's say cardiology department for the first 2 months, so you're getting clinically trained on cardiology, you're getting academic classes, and you will write practice questions in cardiology. So the entire topic is covered. And then if you're moving on to dermat and the third month onwards, so dermat is covered. So because we know we know the split basically. MRCP part 1 has 200 MCQs, if you remember, and out of the 200, the split is you'll have around 11 to 12 cardio questions, you'll have 11 dermat questions, 5 infectious, or maybe 8 gastroentero, like that. So accordingly, we will post you in the relevant departments, make you get clinically trained, academically trained, write the practice questions. So every topic is covered, and by the end of the first year, you will be well equipped for your Part 1 MRCP exam. So you will also write a mock examination with us, and in the mock itself, you will be able to determine how much you're able to get out of 200 self-analyzation. So in case if you're failing in some part, then we will again help you in picking up that particular topic, and then you sit for the actual exam which is happening in India. That is by next September, October, you sit for the MRCP part 1, and if you're getting the minimum required mark, you're through. In case if you fail, you give another attempt in Jan. So in Jan, it's 100% clearance. Okay, so the same training goes on for the MRCP part 2, 200 questions by the end of second year, and then the part 3rd clinical examination at the end of third year. Okay, now, is there any questions so far? Okay, I'm just going to continue further now. So, for the part 3, the MRCP examination, we provide something called OSCE sessions, objective structured clinical examinations, which means all the internal medicine students of the university will be assembled in one hospital, and we bring in an MRCP or an FRCP faculty, so who will come and train you how you have to do the stations. You remember I was talking about those 5 stations, 10 stations, right? So they will be training you how you have to do that. This is repeated once in every 6 months. So basically, you would have improved on the OSCE sessions. Hi participants, can you hear me? I think there was a disconnect in between. Okay, so what was the last thing that you heard from me, participants? Yes, I'll tell you about the stipend also, because I think there was a disconnect in between. Dr. Yakub and Vignesh, what was the last thing that you heard from me? Did you listen to what I said about the OSCEs? The practical assessment part, what we give you for the clinical examination. Okay, fine. I think then you guys have heard about the OSCE part, OSCE sessions, where we train you on how to handle those stations. So you'll be well thorough as to how you have to do it. And obviously, by the end of third year, when you appear for this MRCP clinical examination, again you can take either 1 attempt or 2 attempts, and you will be able to crack it. So once you're done, and then you're flying to UK or Canada or Australia, wherever you want to go. Like say the procedure is, first you have to apply to GMC, General Medical Council of UK, and they're going to ask you for 3 things. One is your UG degree certificate. The second one is your PG degree certificate, for which you'll provide our PG, Texila's PG degree. And the third one is your MRCP or MRCUG or FRCR, the member of fellow of Royal College, that you have to provide. So if you're giving all these 3, then they're going to give you a provisional registration and a visa to travel, and you can directly go there, because this MRCP is equivalent to ST3, that is Specialty Training Level 3 category. Okay, so I guess you might know about what is ST3, Specialty Training Level 3. See, because the usual pathway to United Kingdom is, first you have to crack lab, which will take at least 1.5 to 2 years as per a survey, because it has 2 steps. And then after that, you will be posted in their government hospitals, which is called NHS, National Health Services, for a period of 1 year, and that is called Foundation Year Level 1. So you'll be posted like an intern, and at the end of the year, you'll have an evaluation. If you clear it, then you move on to the next level, which is called Foundation Year 2. So same kind of posting and evaluation. Once you're done with these 2 levels, then they will allow you for your core, whatever is your core, internal medicine or pedia OBG, and that is called your level 1. ST1, Specialty Training Level 1. So depending on the branch's criticality, the levels can go up to 5, 6 or even 8. So internal medicine has 6 levels, so ST1, ST2, ST3. So in order to cross every level, you have to spend 1 year. So if you calculate the number of years that you have to spend to reach ST3, it is lab 2 years, FY1, FY2, ST1, ST2, ST3. So 6 to 7 years by the time you crack your ST3. But the shortcut through Texila is you're spending only 3 years, and within this 3 years, you're not only getting an master degree, you're also getting your MRCP, and MRCP is equivalent to ST3. So you don't need to write lab. You will skip all those levels. You don't need lab, no need of FY1, FY2, ST1, nothing, and you're directly landing in United Kingdom. So which means the next option is to do a super specialization like a DM or an MCH in renowned universities, or you can go for a job. And as I said, the job will fetch you more than 3.5 lakhs package. So super specialization or job opportunities. So this is provided if you have both that is all the 3 parts of MRCP and you're full member of Royal College of Physicians. Now, what if you're not able to complete all the 3 exams and you're just done with 1 or 2 examinations? Still, you can get into United Kingdom. We can send you to United Kingdom through another option called MTI, Medical Training Initiative of United Kingdom, wherein there is a lot of requirements of doctors currently, but they're not getting qualified doctors. See, we Indian doctors only have MBBS MD, but that's in an Indian pattern. So that's why we need to crack lab, which is again a long pathway. So we don't know the UK standard. But if you have MRCP qualified people, I mean, they're looking for MRCP qualified people. Okay, so you're getting an immediate opportunity to work there. So if you have just done 2 parts, like MRCP part 1 and part 2 within this 3 years, then through a conference call, we can arrange with a consultant or specialist in UK in any of the NHS in your internal medicine department, and the requirements are: number 1, your PG in a UK curriculum, 3 years of clinical hands-on training PG in a UK curriculum that is being given by Texila. Number 2 is your MRCP 2-part clearance, part 1 and part 2. Number 3 is to do OET. I don't know if you've heard about this OET. Everybody might be familiar with IELTS. So you don't need to crack IELTS. You can write this OET, which is called as Occupational English Test. So as the name suggests, it's going to test only your proficiency in your profession, in the terminologies of your branch. And that's comparatively very, very easy. And then you can, for that, you can start off preparing by the second end of the second year, second part of the second year. And so by you can crack it within 3rd year itself maximum. So this is all is needed. So your OET certification, your MRCP 2-part clearance, and your PG degree. This is sufficient for you to get a posting there in United Kingdom for a period of 2 years, and that is with sponsorship. So the package is around 2,000 to 2,500 pounds per month you will be getting there. So during your stay of 2 years, you can complete that pending 3rd part, MRCP part 3, which is clinicals. So if you're cracking it, obviously you're becoming a member. So when you're becoming a member, that is equivalent to ST3, Specialty Training Level 3. So when you're at ST Level 3, obviously you can do a super specialization or start off a job. Or if you don't feel like, then come back to India. And obviously your resume has a lot of weightage that you are a UK return and you are an MRCP certified person. So in that case, if you start working in any corporate sector or even in a government sector, the package is definitely higher than a normal Indian MBBS doctor. So all this is being achieved by you without any competition. So you can get into the program immediately, choose the branch you want, choose the location you want, spending the same 3 years time, but getting 2 degrees, which is helping you to work in India and in foreign countries as well with a higher package. Okay, not just this. Once you're with MRCP, after a period of 7 and 8 years, as I told you, you can include your FRCP also, Fellow Royal College of Physicians. Okay, so that is the advantage. So that's what I've mentioned here. You have working options all across the globe, more than 120 plus countries with the member and fellow. And then you can do your super specialization, which I have covered. That is your MCH and DN, be it in India or in abroad. So this is some of our Texila American University's credentials. Like we are part of International Association of Universities, IAU. We are part of the Global Compact, International Center, and our name is even listed in Medical Council of India when it was there. Now, though it is NMC, National Medical Commission, as you all know, for the UG category. And this is a consolidation of what all you can do. You can work in private corporate sectors, own practice, and you can work in government sectors with MRC, PMRCS, and you can go to any country clearing these respective. There is US family, I would say it's tough, but if you want to, yes, it's your choice. But I would recommend a PLAB, that is UK. You don't need anyhow PLAB, you don't need PLAB. And MOH, which is Ministry of Health, or DHA, Dubai Health Authority, or HARD, HAAD is for Abu Dhabi. See, this MOH, DHA, and HARD and all, it's very, very simple examination. And some of you give them exemption also. And there is 3 level of entries, that is Tier 1, Tier 2, and Tier 3. See, even an consultant with 17 years of experience in general surgery was not able to get in as a consultant specialist in Middle East. But if you have an MRCS, you can get the category. So you don't need 17 years of experience in India. All you need is just 3 years. You complete this MRCS and you can choose what you want. It's not like that you're done with only limited option. You can choose, be in India, be in abroad, whatever you want. You have all the options available for you. Okay, so that's all from my end. Do you have any questions, participants? Can you please put in your number, Dr. Yakub, Dr. Vignesh, Dr. Krishna, and Dr. Gautam in my individual chat, your number and the branch that you're looking forward for. So once the webinar is over, I'll get back to you and then I'll give you the details of, if possible, the location that you're looking forward for and more information, the scholarships and the package. Yes, and Yakub had a question. You will be definitely given a stipend. Yes, you will be given a stipend on a monthly basis from the first month onwards. And as I mentioned, the total package depends on 3 things. That is your overall MBBS percentage, the branch that you choose, and the location that you choose. But definitely there is no donation capitation. So you can be eligible for a scholarship. If so, then the package comes down a little bit. So I'll be assisting you on that. Can you put in your WhatsApp number, participants, to my individual chat? Okay, I got it from Dr. Krishna. The rest of you, can you please put in your WhatsApp numbers? And if possible, the location and the branch that you want. Okay, oh, all right. We have options in Bangalore also. Dr. Vignesh and Dr. Gautam, if you can also put in your WhatsApp number and your location, I'll get back to you another half an hour's time and give you more information. All right, all right. Thank you. Thank you so much. Thank you all participants. If you want, see, I will. I have your email address, so we will share the webinar also for you. And I'm sure you have a lot of your friends who are looking forward for PG program, so you can inform them also. And there are certain other earn while you learn options. So while you're doing this PG, there's a lot of opportunity for you to earn as well. That I will tell you guys once I'm on call with you. So it's the same concept, but make down your points. And I will definitely, get back to you another half an hour's time and give you all the details. Okay, so if you're referring someone and if they enroll, you will be eligible for some kind of referral option also for you. So that will be adjusted against your tuition fees. So there's a lot of commissions also available with us, a lot of options, and we are not new in India. There's, so we're doing this since 2011, and we have nearly 800 plus students who are currently into the program. So those who settled in India and those who are working abroad also. All right, so we can share contact number of the students who have completed or who are currently studying, and maybe most of them might be from your own college. We have students from so many colleges like SRM, Pratima Medical College, JIPMA, CMC, Government Medical College. We have from DY Patil, AIMS. So many colleges, students who completed MBBS from these colleges are studying with us and many completed, settled in India and abroad. So we can share contact numbers also. So basically, I would like you guys to get more information and refer your friends also. And this is going to be a golden opportunity for you to get a PG seat of your choice. All right? Okay. Fine. So this webinar will also be available on YouTube as well. Okay, so I would once again thank you all for this wonderful evening and spending your time with me. Hope this was informative for you all. And please refer your friends as well. And kindly make a note of my number, my WhatsApp number, and just send me a hi message in that. As soon as I get into my system, I'll look into it and call you back, guys. All right. So we will intimate you about the next webinar, another topic. And again, thank you for your time and have a lovely evening. Thank you.